Cellular Adaptations, the Great Escape. In the previous session, we learned about the concept of cell injury. Adaptations are reversible changes or reactions of a cell to changes in its environment to survive. Consider the example of a rubber band. When pulled, it thins out. This is called adaptation. However, when pulled excessively, it snaps. Similarly, when a cell encounters stress or injury, it tries to adapt. Cell death occurs when the injury exceeds the cell's ability to adapt. So, what are the various ways a cell can adapt? They are hypertrophy, hyperplasia, atrophy, metaplasia. Hypertrophy is an increase in cell size. Hyperplasia is an increase in cell number. Atrophy is a decrease in cell number and size. And metaplasia is a change in the cell type. Let us understand these concepts with a few examples, starting with hypertrophy. Hypertrophy is an increase in the cell size. Why does this happen? Because of an increase in demand from a cell. Consider a bodybuilder. While exercising, the workload on his muscles increases. This would otherwise cause injury to the cell. However, it adapts by increasing in size and meets the rising demands expected of it. What is the result? The overall muscle expands in size. This is a physiological type of adaptation. But adaptation can be pathological too. A 55-year-old man with long-standing hypertension presented to the emergency department with chest pain, breathlessness, and palpitations. Imaging showed an enlarged heart. What could have caused this? The long-standing hypertension exerted a back pressure on the left ventricle, creating an excessive workload. The ventricle tried to adapt. The cardiomyocytes hypertrophied in an attempt to pump out more blood from the heart. The heart enlarged. Over time, with prolonged hypertension, the cardiac tissue ran out of steam, nutrients, oxygen, and ATP. And that's where the adaptation was overcome by cell injury. Cell death occurred, resulting in myocardial infarction or a heart attack. If you want a fun way of remembering hypertrophy, just think of a famous superhero who, under normal circumstances, is a quiet, introverted scientist. But when instigated by stress, he turns into a mean green smashing machine. Any guesses? Moving on to another type of adaptation, hyperplasia. It is an increase in the number of cells. Hyperplasia is promoted by either hormones or growth factors. Take the example of a lactating breast. The cells multiply in number under the influence of hormones. This kind of hyperplasia is physiological. The human papillomavirus can cause hyperplastic warty lesions in the skin and oral mucosa called verruca vulgaris or condyloma acuminatum. This kind of adaptation can unfortunately also provide fertile soil for the development of cancer. Tamoxifen is a drug used to treat breast cancer. It can cause endometrial hyperplasia, which is a risk factor for endometrial cancer. Ironic, right? So, how does a cell figure out whether it needs to hypertrophy or undergo hyperplasia? The answer is simple. Cells incapable of division become hypertrophic. Tissues that have loads of stem cells and are capable of cell division undergo hyperplasia. Some tissues can do both, an example being the breast during pregnancy and lactation. Let's talk about atrophy. This is a decrease in cell and organ size. Why does this happen? The rule of the body is you snooze, you lose. After a road traffic accident, when a patient is confined to a bed for a long time, the muscles of the lower limbs shrink in size because they are not being used. This shrink in size is atrophy, and this concept is called disuse atrophy. Another mechanism of atrophy is when a cell is deprived of oxygen, nutrients, innervation, or hormones. The cell needs to survive this famine, so it decreases its size and its metabolic needs to survive. The brain undergoes atrophy due to aging and decreased blood supply, secondary to clogged arteries. The picture on the left is of a normal brain. The picture on the right shows loss of brain substance, evidenced by narrow gyri and widened sulci. An interesting comparison would be to Ant-Man. When he shrinks in size, his strength increases. With atrophy, the survival chances of a cell increase. The most drastic attempt of a cell to endure injury is called metaplasia. This is a change from one type of cell to another. It's like the cell is getting a makeover. When injury threatens its existence, it transforms into a tougher, stronger, and street-smart version of itself to survive. Salivary gland ducts are lined by cuboidal cells. When irritated by a salivary duct stone or attacked by an autoimmune disease like Sjogren, it differentiates into a more durable squamous cell. This is called squamous metaplasia. Cigarette smoke causes the ciliated columnar cells of the upper respiratory tract to undergo squamous metaplasia too. Metaplasia occurs due to reprogramming of the stem cells along a new path of differentiation. However, this comes with a price. Altered differentiation increases the risk of cancer, which explains why lung cancer is more common in chronic smokers. Pop quiz. Cellular adaptation is like a regular Joe who works a 9 to 5 job at a firm. When he needs more funds, he works overtime to increase output. That is hypertrophy, an increase in cell size. When he's overwhelmed with work, he asks his colleagues to pitch in. That's an increase in number, hyperplasia. When the boss is out of town, we find Joe lazing in the cafeteria, binge watching his favorite series. Do you recall the concept of disuse atrophy? And when he can't tolerate his boss anymore, he has a change of heart, resigns, and sets up his own startup company. Talk about metaplasia, a complete change in cell type. Autophagy is a phenomenon associated with atrophy. It means self-eating. Starvation in terms of oxygen or nutrients forces the cell to devour its organelles and cytoplasm. This way, it recycles its resources to sustain itself with nutrients and energy. Hope you had fun learning with us. Our further sessions will discuss the sequence of events in cell injury and death.